My name is Dalvery Blackwell. I am the co-founder and program manager of the African American Breastfeeding Network. The network was formed in 2008 to increase awareness, to build community partners, and to denormalize formula use. When I was 13 years old, I began to smoke Newport cigarettes, and both my parents smoked, so tobacco products were always accessible in my family. So I began to steal their cigarettes and take their cigarettes, and by the time I was 18, I realized that I had become addicted to cigarettes. The first thing I would reach for in the morning was a cigarette, so at that time I knew that I was addicted to cigarettes. One of the things that really helped me was prayer, and also weaning myself off of tobacco by smoking fewer and fewer cigarettes each day and each week, and just taking one success at a time. I also, when I had the urge to smoke, I also sucked on peppermint candy, because peppermint candy creates a sensation in the mouth like mentholated cigarettes. It cools the mouth, and I highly recommend that to mothers who are trying to quit, and also maybe chewing on carrot sticks or celery sticks, or even a straw for that matter, because sometimes it's just the feel of wanting something in your hand. You can also pretend as if you were smoking. Exhale, relax, and just really think about all the goodness in your life. Our primary program that we provide are our breastfeeding community gatherings. They take place monthly on the second Thursday of each month, and we take a particular focus of breastfeeding and have a community discussion about it. For example, we talk about the first 7 days after the baby is born, what to expect, what mothers can look for, and how to get breastfeeding off to a good start. We focus on bringing together families together with lactation experts to learn more about breastfeeding and how to support mothers and families. The first 7 days while in the hospital is to immediately after the baby is born to hold the baby skin to skin, and that is bare. The baby is bare and the mom is bare. It's the perfect way to introduce the baby to a place where he or she will spend a lot of time. The baby uses all 5 senses and also stimulates milk production. Also, while in the hospital, asked to speak to a lactation nurse, and avoid bottles and pacifiers. Ask lots of questions during those first 7 days, and breastfeed on demand every 2 to 3 hours. Besides the benefits for babies, which is, reduces ear infections, reduces the possibility of the baby dying for SIDS, reduces respiratory infections, reduces the possibility of obesity and overweight, there's enormous benefits for mothers that we don't hear a lot about. So the benefits for mom are enormous. When a mom breastfeeds, she can burn calories 300 to 500 per day. Her uterus shrinks and contracts back and gets smaller back to its pre-pregnancy weight, and that's what she needs for good overall good health. Breastfeeding is convenient for moms. She doesn't have to worry about preparing bottles and having nursery water. The other benefits for mom is that it delays menstrual cycles, it ends postpartum bleeding, and it releases hormones, oxytocin, that makes her feel good about what she's doing and brings in her maternal instincts. So overall, there's many benefits for mothers that we need to talk more about in our community. Oftentimes, the number one question a mother asks when she's pregnant and considering breastfeeding, if she is a smoker, is it safe to smoke and breastfeed? And the answer is the benefits and the value of breast milk is so enormous, and so we need to find out how many cigarettes a mom is smoking. If she's smoking between 10 and 15, it's safe for her to breastfeed her baby. What we need to talk about too with mothers is not smoking around babies and the effects of secondhand smoke and third-hand smoke. Yeah, oftentimes mothers wonder if they can have cigarettes and smoke while breastfeeding, as I mentioned before, the answer is yes. And once they realize that they don't have to stop smoking and that they can breastfeed, they begin to take more classes, learn more about breastfeeding, and working more closely with cessation resources in the community, and even consider sometimes decreasing the number of cigarettes they smoke so that they are providing the baby with the best nutrition and is able to breastfeed on demand every 2 to 3 hours. So in general, mothers do tend to breastfeed who are smokers. The goal is to increase exclusivity and duration during that time. So mothers may wonder if nicotine can pass into the breast milk, and in order for the nicotine and the other ingredients of tobacco to pass into the breast milk, mothers have to smoke between 10 and 15, and those ingredients have to pass into the blood plasma compartment at a very high level. And typically most mothers do not smoke more than 10 to 15 cigarettes per day. If you do, we advise a mother to immediately seek cessation resources and help in the community and try to reduce the number of cigarettes that she smokes before the baby is born and after the baby is born as well. If you are planning to smoke, we encourage you not to smoke in the house, in the baby room, and to go outside to smoke. You should identify a light hat and jacket and scarf to wear when you are going outside to smoke, and to cover your head, your body parts, your hands, maybe some light gloves that you can wear, and a scarf. And when you go out to smoke, when you come back in, take all of those things off, put them inside a bag, and then put that inside a closet, and wash any skin that was exposed to the tobacco smoke. Great. She can call us at 414-264-3441. Again, that number is 414-264-3441.